Hey everyone, and welcome back to the channel. I want to talk about something incredibly important today, especially for those of you enjoying your golden years or helping a loved one navigate them. We work our whole lives looking forward to retirement, picturing travel, grandkids, and peaceful mornings. But one small oversight can turn that dream into a stressful nightmare, and that's what we're going to prevent today. Are you over 60? Then you absolutely cannot afford to miss this. We're going to uncover the three most common, yet easily avoidable health insurance mistakes that seniors are making right now, and how you can sidestep them in 2025. This isn't just about saving money, it's about protecting your health, your peace of mind, and your future. So grab a cup of tea, get comfortable, and let's make sure your retirement is everything you've dreamed of. First up, and this one is a biggie, is simply letting your plan auto-renew without a second thought. It's so easy to do, right? You get that notice in the mail, you're busy, and you think, well, it worked fine last year, so let's just let it roll over. But here's the catch. Insurance plans change every single year. The premium might go up, which is bad enough, but what's often overlooked are the more subtle, costly changes. Your co-pays might increase. Your favorite doctor or the specialist you trust might suddenly be out of network. And most critically, the prescription drug formulary, that's the list of medications your plan covers, can be completely overhauled. A medication that was affordable this year could cost you hundreds out of pocket next year. I recently spoke with a financial advisor, Sarah, who specializes in retirement planning. She told me a heartbreaking story about a client, a lovely gentleman named Robert, who let his plan auto-renew. He didn't realize his essential heart medication was dropped from his plan's preferred list until he went for a refill and was hit with a bill for over $500. He was on a fixed income, and that unexpected expense was devastating. So, what's the takeaway? Treat the annual enrollment period like an annual financial checkup for your health. Mark it on your calendar. When that renewal notice arrives, don't just file it away. Open it, read it carefully, and compare it to other available options. Your health needs can change, and your insurance plan needs to change with you. Taking just an hour or two to review your options can save you thousands of dollars and untold amounts of stress. It's your health, and you deserve a plan that truly works for you. Now let's talk about mistake number 2, and it's one that trips up so many people: underestimating your prescription drug needs. This goes hand in hand with our first point, but deserves its own spotlight because it's where the hidden costs really ambush you. Many people, when choosing a plan, focus solely on the monthly premium. They see a low number and think, great, I'm saving money. But a low premium plan can be a trap if it doesn't cover your specific medications. Think of it like buying a cheap car that only takes super premium hard-to-find fuel. You save up front but pay dearly down the road. When you're evaluating Medicare Part D plans or Medicare Advantage plans that include drug coverage, you must do your homework. Don't just assume your prescriptions will be covered. You need to take your list of medications, and I mean every single one from daily pills to occasional creams, and check them against the formulary of each plan you're considering. The official Medicare Gov website has a fantastic plan finder tool that lets you do exactly this. You can input your specific drugs and dosages, and it will show you the estimated annual cost for each plan, including premiums, deductibles, and co-pays at your preferred pharmacy. We had a viewer, Mary, write in to share her story. She switched to a plan with a premium that was $20 cheaper per month, saving her $240 a year. She was thrilled until she realized her arthritis medication wasn't covered, and the out-of-pocket cost was over $300 a month. That cheaper plan ended up costing her thousands more. Don't let that be you. Your prescriptions are not an afterthought, they are a central part of your healthcare. Make them a primary factor in your decision, not a secondary one. A slightly higher premium for a plan that covers your drugs is almost always the smarter, more cost-effective choice in the long run. All right, let's move on to the third critical mistake, and this one is about overlooking the power of extra benefits. For years, original Medicare was pretty straightforward. Part A for hospitals, Part B for doctors. But the landscape has changed dramatically, especially with the rise of Medicare Advantage plans, also known as Part C. Many seniors, particularly those who've been on Medicare for a long time, are in the habit of thinking that things like dental, vision, and hearing aids are just not covered. They assume they have to pay for all of it out of their own pockets, and these costs add up fast. A pair of hearing aids can cost thousands of dollars. A simple dental crown can easily be over $1,000. But here's what you might be missing. A huge number of Medicare Advantage plans now include these benefits, often for a $0 additional monthly premium. They roll it all into one package. I was talking to a retired nurse, David, who was paying for a separate expensive dental plan and still putting off getting new glasses because of the cost. He was shocked when he finally explored his Medicare Advantage options and found a plan that included a generous allowance for dental work, new eyeglasses every year, hearing aid coverage, and even a gym membership through the Silver Sneakers program. He switched plans, dropped his separate dental policy, and immediately saved over $100 a month, all while getting better benefits. This isn't a rare occurrence. Plans are competing for your business, and they do that by offering valuable perks. They might offer transportation to doctor's appointments, meal delivery after a hospital stay, or an allowance for over-the-counter items like vitamins and bandages. Ignoring these benefits is like leaving free money on the table. So when you're doing your annual review, don't just look at the medical and drug coverage. Look at the whole picture. Ask yourself, what else do I spend money on for my health? Do I need glasses, dental work, hearing support? Then, actively look for a plan that helps cover those costs. These extra benefits are designed to keep you healthy and can significantly improve your quality of life while protecting your savings. Don't overlook them. So let's quickly recap the 3 major mistakes we want to dodge in 2025. First, never let your plan auto-renew without a thorough review. Your needs and the plans themselves change every year. Second, don't underestimate your prescription drug costs. Use the official tools to check your specific medications against every plan you consider. A low premium isn't a good deal if it doesn't cover your meds. And third, don't overlook the valuable extra benefits like dental, vision, and hearing that are often included in Medicare Advantage plans. These can save you a fortune. Navigating health insurance can feel overwhelming, I know. But taking these 3 steps puts you back in the driver's seat. It transforms you from a passive recipient of whatever insurance companies decide to change into an active, empowered consumer, making the best choice for your unique health and financial situation. This is your health, your money, and your retirement. You've earned the right to have peace of mind. If you found this information helpful, please give this video a thumbs up. It really helps the channel reach and help more people just like you. And if you haven't already, consider subscribing and hitting that notification bell so you don't miss our future videos designed to help you live your best life in retirement. Thank you so much for watching. Stay healthy, and I'll see you in the next video.